Hello, good morning everyone, and welcome to Paces Diaries. This is Dr. Moses, founder of the Paces Diaries. Today I'm going to demonstrate something very important. The red flag signs of Paces examination. If you do these red flag signs in an examination, then sure you're going to fail. So we are going to see the very first red flag. All right. Now I'm going to call a doctor and I'm going to ask him and ask this candidate to demonstrate plantar. Can you please check his plantars, doctor? Please. All right. I'd like to stop here. The two blunders candidate do while checking plantar is, number one, using something like this. The back of a keychain. Never use that. The other thing which I found candidates doing is take a knee hammer and then using the back of the knee hammer to check the plantar. That's again another blunder. That's a red flag. You are likely to fail the examination. The right thing to do is take an orange stick. It's just like an ice cream stick. In UK we call it as an orange stick. Just use it to elicit the plantar and your job's done. Never use the back of the knee hammer and never use a keychain. Right? Thank you. Now let's see the red flag sign number 2. Doctor, can you please auscultate this gentleman? Doctor, can you stop, please? This is red flag number 2. Never, ever auscultate a patient over his clothes. Never do that. Suppose you can get a female patient, even in spite of that, never auscultate over the clothes. Take the permission, gently lift up the clothes and gently auscultate, but never, ever over the clothes.
Can you please present your findings, doctor?
Yes, ma'am. On physical examination, I found hepatomegaly, splenomegaly. The person had asterixis. He has icterus. So I think this is a case of DCLD.
Now, this patient doesn't have any of these findings which he has mentioned. This is what is called inventing signs or creating signs, which is not at all favored in the PACES examinations. Even if you're not able to pick up the findings or unsure, you can very well mention that you have not been able to pick up or you're not clear. But preferably never ever invent or create signs, which is a sure shot fail and it is one of the red flag signs. Please examine the abdomen. Please stop. This is another red flag sign, eliciting pain. This is marked negative in patient welfare, and eliciting pain and the patient wincing in pain is marked negative and is a sure shot fail. If the patient is in pain, always apologize to the patient, ask if you can continue. If not, if the patient is in pain, please stop then and there and do not proceed and apologize. Doctor, your time's up.
Please.
Doctor, your time's up. You'll have to stop examining.
Please let me present the case and examine the patient. You didn't give me enough time. How am I supposed to present the case? Otherwise, you'll cut my marks on that.
This is called arguing with examiner, which is a sure shot fail and a red flag sign in PACES exam. Never ever argue with the examiner.